So it's 1 o'clock, and welcome to all of you to the um, pre-meeting for the Collaborating Centre for Values-Based Practice conference, coming to you uh, live, as it were, from St Catherine's College in Oxford. Next slide, please. So welcome to all of you. I'm delighted that we've been able to host this. We had planned this as a in-person conference, but of course events have overtaken, and we thought it important to go ahead with some form of meeting, albeit remotely for the vast majority of us. Next slide, please. So I thought maybe it was worth just thinking about how did it start, and in fact, it started by me purely serendipitously being put next to Bill at a dinner at St Catherine's College, and this is the quad in the college which many of you have visited, and we just happened to be chatting after dinner, and said, "Oh, what do you do, Bill?" And Bill told me a bit about it, and I thought about it at the time, thinking, well, Bill, this is stuff that we do every day. But as he talked a bit more, I realized that actually we weren't really doing values-based practice. We thought we were doing it, but much of what we were focused on, certainly in secondary care, in hospital-based medicine, seemed to be rather fitted around the service or around the clinicians, not necessarily always around the patients. So I said, look, we should talk a bit more about this. And Bill said, that's a very dangerous thing to say to me, because if you say, let's meet again and talk, I will contact you. And having had the go-ahead from me to make sure that I got chased, Bill certainly did. And that's how it really started. And it was purely a chance meeting, sitting next to Bill for dinner. And it turned out to be a rather fruitful dinner after all. Next slide, please. So we met up after that, and that's the sort of serendipitous thing that can happen in colleges like Oxford, where you are expected to come and sit to the next person at dinner, and you have no idea whether you'll be sitting next to a physicist, a philosopher, as it was my fortune to be that day with Bill, or a chemist or a historian, or somebody else outside your field, and that's the rather wonderful thing about it. Next slide, please. So what did we do? So we set up the centre early in 2015. We had our first advisory board meeting in July 2015, and we thought we would focus on three areas: in regulation and policy. And as regards that, we ended up with providing training sessions for the senior leaders in the Care Quality Commission, in NICE, in the Professional Standards Authority, the Academy of Medical Royal Colleges, and also roundtable discussions led by Bill with Lord Victor Adebowale in the House of Lords. In education, we set out, and over the last 5 years, we had intended to have 8 advanced study seminars a year, and we ended up with 50, as well as working with educational programs in 13 surgical specialties, but as also other professional groups, as you'll hear later on today, including radiographers, pharmacists, paramedics, primary care, occupational therapy, as well as osteopathy. And then we wanted to go ahead and set up research programs, and out of that, so far we have, over the last 5 years, 54 organizational partners, 174 individual partners, as well as 8 research networks. And you'll hear again today a small sampling of some of those networks and the richness that has come out of those. And whilst all this was going on, we also partnered up with CAPE, and you'll hear a bit about that from Laura, with the International Altogether Better Healthcare Conference in in 2018 and sorry 2016, and that had just under 700 participants. We also ran the first national conference called Montgomery and Me around consent and the new Montgomery ruling as it was then. Interesting that Baroness Hale, who then became the president of the Supreme Court, was in Oxford this week giving the Romanas lecture yesterday lunchtime. And we also ran a national meeting on talking about dying with Evan Davies. So that's just to give you a flavor of what we've done over the last 5 years and a couple of months. Next slide, please. And the people we need to thank are our inaugural advisory board, and I won't name them all, but they are on the website. But in particular, the chair of that, Roger Ainsworth, who is also the late Roger Ainsworth, I should say, the late master of St. Catherine's College, but helping Bill and I steer the idea for the centre through the governing body and the support of the 42 governing body fellows in saying that the centre could be hosted as a virtual centre at St. Catherine's, and the prime funding we had from the Laces Trust in getting the centre established and funding those advanced study seminars. And then finally, really all of you who are here today and many other colleagues who can't be here today, from the variety of professional groups. And each of those seminars, we did insist that we involved patients and service users as an integral part of the collaborating centre's work. Next slide, please. So this is a photograph of Roger Ainsworth, and I'm pleased to say that despite his sad death last year, he was a great supporter of the centre, got it up and running, and gave us a lot of advice. And the college has in his memory named our new graduate centre the Ainsworth Graduate Centre at St. Catherine's. And I hope that when COVID settles down, that those of you on this meeting will be able to come and visit and look at that. Next slide, please. So I just wanted to use this opportunity to also thank Bill Fulford for one, sitting next to me at dinner, talking to me, and then pursuing things in making this a reality and the centre work. So Bill, I want to hand over to you as the current director of the Collaborating Centre.
So thank you very much, Ashok, for your very kind words. I'd like to thank Ashok in return because, as Ashok knows, one of my many failings was that I failed as a surgeon. And so it's been particularly exciting for me that so much of this work has been picked up through Ashok's program in surgery. And Ashok is a vascular surgeon, and in the Nuffield Department of Surgery here, it's been a great, very exciting for all of us that the work is being carried forward in that area of medicine. My background, of course, is in psychiatry rather than surgery. So we've really spanned, and we're going to hear, as Ashok said, a sample later on from people across a number of medical and paramedical disciplines. And it's that collegiality of the whole program, I think, that has really made it effective.